unevenly distributed, and unable to utilize even the insufficient funds allocated, leaving thousands of patients to die every year for lack of treatment. And nowhere is this pattern of neglect more glaring than in the case of the long-promised AIIMS in Kerala. First year of the NDA government, the promise was announced. The promise still remains unrealized. A state with one of the strongest public health records in the country continues to wait, while this budget, like its predecessors, offers neither clarity, nor timelines, nor urgency. 22 AIIMS have been sanctioned across India, Mr. Chairman, but when it comes to Kerala, the silence is deafening. And AIIMS that is not even a dot on a map is not institution building, it is institutional disregard. Kerala does not lack need, capacity, or credibility. What it lacks, it seems, is visibility in this government's priorities. Why, Mr. Chairman, is Kerala invisible to this government? I'd like to know. Equally telling is the silence on air pollution. After months of public outrage and choking headlines, the finance minister's speech found space for everything except the air we breathe. The National Clean Air Programme still runs on 2009 standards, weaker than the WHO's PM 2.5 norms, even as pollution control funding has been cut from 1,300 crores to 1,091 crores this year. A budget that saves on rupees but ignores the air its citizens breathe reduces development to bad arithmetic, not good progress. Mr. Chairman, the announcement of 3 new National Institutes of Pharmaceutical Education and Research, or NIPA, raises a troubling question of balance and intent once again. I'm sorry to return to my state, but Kerala, despite one of the country's strongest public health ecosystems and a proven record in healthcare delivery, once again went unaddressed. Even as NIPAs are concentrated and clustered in northern and eastern India, and a single institute in Hyderabad is expected to serve the entire south. This imbalance is not new. I flagged it 2 years ago when I was chairman of the Standing Committee on Chemicals and Fertilizers. At a time when over 60% of India's 8,500 MSME drug units lack support to adopt even good manufacturing practices, such skewed institutional allocation risks shrinking rather than strengthening our manufacturing base. It also does little to reduce our dependence on China for nearly 2/3 of key active pharmaceutical ingredients, or to correct India's anemic R&D investment of just 0.64% of GDP, with even large pharma firms spending under 1% of net sales on their research. The result is predictable: limited innovation, continued reliance on low-cost biosimilars, and life-saving